Hepatitis is a word that means inflammation of the liver. The two well-known viruses that cause hepatitis are hepatitis B and hepatitis C. Most people with the disease look and feel fine. In fact, up to 40% of people living with hepatitis do not even realise they have it. The long-term chronic symptoms include jaundice, yellowing of the eyes and skin, fatigue, abdominal pain, sensitivity to fatty foods and alcohol, brain fog, bruising and swelling. If left untreated, it can lead to cirrhosis, liver failure and liver cancer. There is an effective vaccine for hepatitis B, but not for hepatitis C. Most people can clear the Hep B virus naturally without medication, but for those who do not clear the virus, they are deemed to chronic infection, which can result in a lifetime of medication to stop the virus from damaging the liver, and also significant lifestyle changes, including no or severely reduced alcohol and drug consumption, no unprotected sex, no sharing toothbrushes, razors or tooth floss, being extra careful with cuts and grazes, eating a healthy diet, and getting regular GP checkups. Hep B and C are both passed on through blood. It is most often passed on through blood-to-blood contact, such as sharing drug injecting equipment. However, being a blood-borne disease, unsafe tattooing also carries a big risk of infection. Tattoos are images which are created by injecting ink into the dermal layer of the skin using needles. Contamination can be a huge risk if you or your tattoo artist is not careful. There are a few things you can do to help lower the risk. Always get a tattoo at a reputable tattoo studio by a trained artist. A good tattoo artist knows the risks and will take steps to keep you safe. Viral hepatitis can stay infectious outside of the body for up to 7 days. The tattoo artist should use new needles, razors and sterilised equipment. Make sure the studio looks and smells clean when you walk in, and your artist should have clean hands and wear gloves during the tattoo process. It is very important to feel safe. Do not be afraid to ask questions and to back out if you are concerned or unhappy about the hygiene standards of the studio or the artist. It's not over after the tattoo is finished. Aftercare is important as your new tattoo is an open wound that needs to be looked after properly. Follow the directions given to you by your tattoo artist. Keep the area clean and most importantly, do not let it come into contact with the blood or body fluids of another person. Hepatitis is easy to avoid if you know how. A backyard tattoo or having a bit of fun with a mate's tattoo gun may be a cheap alternative to going to a proper studio, but the risks of infection can be huge and potentially life-changing. Remember, you can always cover up a bad tattoo, but you can't cover up hepatitis B and C.